Good afternoon and welcome to the third session on Kids Health Talk for Parents, live relay from MGM Healthcare, Chennai. In the last two sessions, we had covered topics on what is a pediatric emergency and about fever and how should a parent handle a fever for a child. Today we have with us Dr. Deepa Easow, the Senior Consultant from the Department of Pediatrics from MGM Children's and MGM Healthcare. Dr. Deepa will address all concerns about loose stools in children and how worried should a parent be. Welcome, Dr. Deepa, for this session.
Thank you. Thank you, Lisa.
So let's start off with this question. What is diarrhea in children?
Good afternoon. Diarrhea is a condition that is very commonly seen in children. Data has shown that an average Indian child can have 2 to 3 episodes of diarrhea in a year. So you can see how common an issue it is. But the good news is that most diarrheas in children are self-limiting. So now what is diarrhea in children? When would we say that a child is having diarrhea? Diarrhea is defined as any difference in the frequency and in the consistency of a stool from the normal of a particular child. For example, a child who normally passes stool only once a day suddenly starts passing stool 3 to 4 times a day, and the consistency is different. It's loose stools. Then we would say that the child is having diarrhea. Older children, any episode that is like more than 3 episodes in a 24-hour period, that again would be loose watery stools, more than 3 episodes in a 24-hour period, again we would call that diarrhea. Now what is not diarrhea? In children, there is a difference in their stool. It changes throughout their life. For example, in newborns, a newborn in the first couple of days can have very loose stools. And those stools are known as transitional stools. They'll be very watery stools with little flaky material in the center. Most parents are concerned that that is loose stools, but that is not loose stools. It is because of the difference in the breast milk that takes place in the first couple of days. So that is known as transitional stools. The children will be active, the babies will be voiding urine well, and that is something that is very transient. So that is known as transitional stools. That is not diarrhea. It need not be treated. The other condition is breastfed babies. Breastfed babies can have even 10 episodes of stools in a day. The mother can be feeding the baby and the baby can have a stool. That is very, very normal, and the baby will be gaining weight normally. So that is very normal. So breastfed babies, there can be a spectrum. They can have a stool once in 5 to 6 days, which is normal, or they can have a stool after every feed. That is also normal. So that should not be considered as diarrhea and treated. The other condition that usually is mistaken for diarrhea is a child having greenish stools. That is also not diarrhea. It can be very normal for a child to have green stools once in a while. A toddler having something known as an exaggerated gastrocolic reflex. The child has a meal and wants to have a stool. That again need not be diarrhea as long as the child is gaining weight normally. Children who sometimes pass undigested food material in the stool. Many parents are concerned about that. They feel this child is not able to digest this food and they just take it out of their diet. But that need not be diarrhea. A child that has carrot sometimes passes small pieces of carrot in the stool. That can be very normal. So that should not be treated as diarrhea. Now, diarrhea itself can be different types. There's something known as acute watery diarrhea, and that is the most common type, and that is usually viral. The usual cause is viral. So that is an acute onset of diarrhea where the child suddenly starts having loose watery stools. Could be associated with fever, could be associated with vomiting. Now that is usually lasts for about a week, never over 2 weeks. Usually the child will settle within that period. The other condition is dysentery. Now in dysentery, what happens is the child will be passing blood and mucus in the stool. So that usually the causative organism is usually a bacteria. So this is something which is a little bit more serious. So the child will have fever, the child can have vomiting, the child can have abdominal pain. And in this, the child can have something known as tenesmus, where the child has severe abdominal pain and feels like passing a stool. So all this usually points to a bacterial infection. And then, of course, we have something known as persistent diarrhea, which usually is diarrhea that lasts for more than 2 weeks, for which the management is something different. The usual cause of diarrhea in children is infection. And most of the time, it is a viral infection.
So the dysentery is different from diarrhea.
Yes.
So what should a parent do if they find that the child has diarrhea?
That's a very important question, because what a parent does immediately after a child starts having diarrhea is very important, because that can prevent a lot of the complications. So the important thing that the mother should do once the mother identifies that a baby is having diarrhea is the mother should start a miracle drug, which is oral rehydration solutions, oral rehydration salts. So this is something, this is a miracle drug, and it has changed the management of diarrhea over the years. The number of deaths due to diarrhea, the number of complications due to diarrhea have come down remarkably after the introduction of this drug. So this really is a miracle drug. So this is something that all mothers should start. So now diarrhea, nowadays you don't have to prepare this at home, because this is readily available in most medical stores, and it is available as in 2 sizes. It is available as a small sachet or as a bigger sachet. Both can be used for children. Only thing is the dilution is a little different, and the important thing is it must be reconstituted the way it is written in the sachet. Now, a small sachet should be reconstituted in only 200 ml of water. That is 1 tumbler of water. And the water doesn't have to be boiling water or anything like that. It's just good, clean drinking water. So 1 sachet of this small packet, you dissolve it in 200 ml of water, and 1 sachet of the big of this big packet, you dissolve it in 1 liter of water. And it can be kept for up to 24 hours. Especially this 1 liter sachet can be kept for 24 hours. And the way it should be given is small sips of it should be given. In small children, what we say is usually give it in a teaspoon. Every 1 or 2 minutes, give it in a teaspoon. It should not be given at one go, the whole thing at one go, because invariably the baby is going to vomit, and that's not going to help. So it should be given in small sips. Older children, of course, small children in teaspoons, and older children in sips. Now, supposing a child vomits straight after ORS is given, it does not mean that ORS should be stopped. It just means that you give the child a break, and then you restart again, and you give it a little bit more slowly. So this is what this prevents. This is a drug which prevents dehydration, and it also can be used for treatment of dehydration. So early signs of dehydration, if this is started, it can prevent the child from going into further complications. So it is extremely important that this is done. The other thing is small infants, babies especially less than 6 months, should continue to be breastfed. Breastfeeding should not be stopped. In fact, we say that when a baby is having loose stools, a mother should increase the amount of breastfeeds given, because usually sick babies will refuse everything else except breast milk. And breast milk itself can do wonders. So mothers should continue to do that. And the other thing, older children should continue to be given the diet that they were normally given. That should not be withheld from them. Of course, the baby is going to have a loss of appetite because of the infection, and is going to have a little bit of vomiting. But whatever small amounts of feeds can be given, easily digestible feeds can be given, it should be continued. So that is the second thing that the mother should do. And then, of course, the third thing that the mother should do is the mother should observe the baby for early signs of dehydration. So how does a mother? Dehydration is the complication that we are worried about. So how does a mother identify a baby having dehydration? One of the early signs of dehydration is increased thirst. The child suddenly is becoming extremely thirsty. So that shows that the baby is losing a lot of the water from the body along with electrolytes. So that is an indication that the mother should start giving a lot of the either ORS or even home available fluids. So what are some of the other home available fluids that the mother can give? So the mother can give lassi, buttermilk, tender coconut water. So these are some of the other home available fluids that the mother can increase in giving to prevent the child from going into further dehydration. So some of the other signs of dehydration is there is a soft spot on the skull of a baby. So usually mothers they know where the soft spot is. So in a baby that is getting dehydrated, if the mother touches the soft spot, you see that it is sunken. That is because of the loss of the water. The other thing is you look at the baby's eyes. The baby is crying, there'll be lack of tears in the eyes. The eyes will start looking dry. You look at the tongue and the lips, they'll start looking dry. Then if you kind of pinch the skin on the tummy of the abdomen, normally it will go back very fast. If a baby has lost a lot of water, the skin tends to lose its elasticity. It will go back very slow. The other thing that can be used to monitor dehydration is the urine output. Now, supposing a baby has not voided urine for the past 6 to 8 hours, or passing very small amount of urine, which is high colored, very concentrated, that is an indication that this baby is getting dehydrated. So these are some of the signs that the mother should keep an eye on, because if any of the baby develops any of these signs, that is an indication that the baby is getting dehydrated and you need to increase the amount of fluids and maybe take the baby to the hospital. So some of the things, that is definitely ORS should be started at the earliest possible, continue the feeds that the baby was getting and look for signs of dehydration. So these are some of the things that the mother can do immediately after a baby is having diarrhea.
Those are really important early warning signs you gave, Dr. Deepa, because most of us as parents, we tend to panic the moment we see a child, continuously having diarrhea, not drinking enough water, because these are real good early warning symptoms that you told us that we can actually look for. And some children usually hesitate drinking the ORS. They don't feel it nice to drink. It's not tasty. It is not like any of the usual juice that they drink. How to convince them to have the ORS? Do they have other options in ORS itself?
Yeah. Nowadays, we have something known as flavored ORS. So this is something that adds a little bit of flavor and it adds a little bit of color, which many children will fall for. The ordinary ORS is colorless. So maybe children don't like to take something like this. This, especially most of it is orange colored. So when this is given, usually they tend to take it, So that is one way of doing it. And as I said, other home available fluids should be encouraged. If a baby is not taking too much of ORS, try to give other home available fluids like tender coconut water. It's got high quantity of potassium, which is lost during a diarrheal episode. So that will help in replenishing the volume of potassium. Dal water is good, lime juice is good, lime juice is good, lassi is good, buttermilk is good. So these are all the other things that can be given during a diarrheal episode to increase the fluid intake in a baby.
So while we're talking about the intake that we can give for a child, are there any food that we should not give at the time of a child having an episode of diarrhea? Any no-no food? And also explain to us what are the good superfoods that we can give for a child who's experiencing diarrhea.
Okay. So what should not be given definitely is, sugar, foods with a high quantity of sugar in it. For example, a baby is a little tired. So the mother feels, okay, I can give some glucose. So they buy a packet of glucose, and they dissolve it in water and give it. That is definitely not going to help. It might give a boost of energy at that time, but that is not going to help in the long run because of the sugar content in it. It is going to push the water out again, and the baby is only going to get dehydrated. So that is something that should not be given. So plain glucose should not be given. Carbonated drinks are a big no-no. So no carbonated drinks should be given to any baby just because the baby is not taking ORS. The other thing is fruit juices with a high quantity of sugar in it is not going to help. It is much better to give the fruit. For example, mashed bananas can be given. You were asking about superfoods. So mashed bananas can be given during a diarrheal episode. Apples can be given. So all these kind of things, it is better to give the fruit than give it as a fruit juice. So fruit juices definitely should not be given. And in older children, we say don't go very heavy on the milk. Don't think that the child is not eating anything else, so let me give more milk. Because sometimes what happens is the milk tends to kind of cause more diarrhea. So milk should not be given on an overdose. Ordinary amount of it is fine, but then too much of milk should not be given. Instead, give it as dairy products, as buttermilk, as lassi, as curd. So that is something that will help.
So when is diarrhea worrisome? So we are talking about managing children at home who have an episode of diarrhea. When should that be a cause of worry for a parent?
A small baby, for example, a baby less than 3 months or say 6 months having a diarrheal episode could be an indication of an underlying infection. So those babies should be taken into the hospital much earlier than you would an older child. It's because that child needs to be looked at by a pediatrician. Any baby with blood and mucus in the stool, that is an indication that the baby needs to go into the hospital because you need to take a look at the baby. Then there are, as I said, the warning signs are there. A baby that is lethargic, irritable, not taking in anything, is not, or is having intractable vomiting, is not able to tolerate any amount of liquids at all, or is refusing to take it, is just lying there lethargic on the bed, or is having a very high purge rate. Continuing to have high purge rate. So that is an indication that the baby needs to be taken into the hospital much earlier. Any baby that has not voided urine for a long time, say for 12 hours, the baby has not voided any urine, that is an indication that the baby is going into severe dehydration. So that baby should be taken into the hospital immediately. Now, sometimes what happens is the purge rate comes down. The number of loose stools comes down, but the child is still looking very sick, lying down. The tummy is a little bloated up. That doesn't mean that the baby is getting better. Just because the purge rate has come down, that doesn't mean that the baby is getting better. Could be that the baby is going into complications of the diarrhea. So that is a condition so the mother should look at the overall condition of the baby, not just the purge rate. So overall, the purge rate has come down, but the baby is still looking sick, looking lethargic. That baby also should be taken into the hospital. Now, the other conditions that the baby should be taken into the hospital much earlier is if a child has got other associated symptoms along with the fever, along with the diarrhea. For example, dengue fever can present with diarrhea. Typhoid fever can present with diarrhea. Malaria can present with diarrhea. And now we have COVID. COVID also can present with diarrhea in children. So, for example, someone is COVID positive in the house and this child develops fever with blue stools. So the mother should be a little bit more worried about that. So a child has fever with a rash and has diarrhea. So that is a condition that definitely needs to be looked at immediately because it could be a dengue, or could be a typhoid fever presenting with diarrhea. So these kind of conditions definitely need to be looked at immediately. So the mother should not hesitate in taking the baby into the hospital so that a pediatrician can take a look at the baby and assess and see whether we are dealing with something else and the primary infection is not in the gut. It is something else which is causing it. So even children with pneumonias, with ear infections can have diarrhea. So any other associated symptom is there. The children should be taken into the hospital and shown.
That's a very important point because we always tend to think that diarrhea itself is a problem. But diarrhea could also be a symptom for an underlying problem. Thank you for that clarity, Dr. Deepa. So when we have siblings in the family, so one child has diarrhea, is there a chance for the other child to get diarrhea too?
Definitely, because diarrhea, as I said, the main cause of diarrhea is infection. And the stool that the child is passing is infected. So if proper hand washing is not done, either by the child or by the caretaker after changing diapers, and food is prepared or the other sibling is fed, then definitely there's going to be a spread of the infection. So it is extremely important that when one child is having diarrhea in the house, proper hand washing is done both by the caretaker and if it's an older child, definitely by the child itself, and especially after using the restroom and before eating food and things like that, so that there is prevention of infection to the other siblings in the house.
So what are the common myths that gets associated with diarrhea? I'm sure there would be lots of myths because anything to do with children, we tend to associate it with some myth or some kind of a link that might not be actually true. So can you explain some myths that generally get associated with diarrhea?
Yeah, so one of the myths that I always hear, where parents tend to bring the child late to see a pediatrician is, my child was teething. So I thought that the diarrhea was associated with that, and that is the reason why I'm bringing the child late to the hospital. I thought it will settle, and it didn't settle, and now I'm bringing the child to the hospital. So that is definitely a myth, Teething per se does not cause diarrhea. It is probably a coincidence that the child has developed a diarrhea at that time. One of the reasons that can be said is, a child that is teething, when the tooth comes out of the gum, it can be extremely irritating for the child. So what happens is the child tends to bite everything, put everything into the mouth, just wants to bite at everything. So what happens is the child probably is putting either their hands into their mouth or putting another object into the mouth, which could be contaminated. And that could be a reason why the child is developing an infection at that particular time. Teething per se does not cause diarrhea. So definitely nobody should kind of defer treatment saying that I thought that the child was teething and that is the reason why the child was having diarrhea. Any child with diarrhea, as I said, most of the time it is an infective origin and we need to actively start treating diarrhea.
So also when there are conditions where a child is given antihelminthic drugs, deworming drugs. So is there a chance a child develops diarrhea because of deworming drugs?
No, it's very unlikely that a child is, most going to get a diarrhea because a child has been put on a deworming drug, And we usually do not deworm during a diarrheal episode, but it is good to deworm children, once in 6 months. It is good to deworm children. That per se is not going to cause any diarrhea. And at this time, one important point that I would like to say when we're talking about drugs is, as I said, most of the time, the only wonder drug that is required for diarrhea is this. And indications for antibiotics, as I said, was blood and mucus in the stools or any other associated infection along with the diarrhea. Only then we would start antibiotics. So it is absolutely imperative that mothers do not start antibiotics for a child just because a child is having diarrhea. Because what will happen is, if it is a viral diarrhea, starting antibiotics for that child, we are going to start producing something known as antibiotic-associated diarrhea, because what happens is that especially breastfed babies tend to have good bacteria in their gut. So when we give antibiotics indiscriminately, what happens is we are killing all those good bacteria. So what happens? There is an overgrowth of the bad fellows, and that is going to cause more problems. So what is started as a viral would end up becoming a bacterial, and it's going to take a longer time. So mothers should definitely not start antibiotics on their own. The other drug that is usually, parents are tempted to start is something like anti-motility agents, things like Lomotil and things like that, loperamide, which is usually probably given for adults, patients. They're tempted, they feel that if that is given, the loose stools will stop immediately. But that is definitely not advised. We are really not concerned about the purge rate in children as long as the children are kept hydrated. It is going to settle. The child is taking orally, the child is voiding urine, active. Don't worry about the purge rate. The purge rate will come down as the days go by. As I said, usually it all settles within a week's time. So there is no hurry to kind of bind and stop the loose stools. Because in children, what happens is during a diarrheal episode, already the gut is infected and the motility, the movement of the gut is slowing. And when we go and give these anti-motility agents, we tend to slow it down even further. And that can cause complications where the baby can develop abdominal distension and things like that, which can cause a lot of problems. So that definitely should not be given.
So can diarrhea be prevented? Is there anything that the parent can do to prevent a child from getting diarrhea itself?
Good question, a very good question, because prevention is definitely better than cure. So to a certain extent, as I said, because it is infective in origin, so definitely the infection is through the oral route. So something unclean has gone into the baby's mouth, and that is the reason the baby has developed an infection. So if we maintain a clean environment, to a certain extent, we can, prevent diarrhea. Right now, I think this concept about clean hands is really going around because of COVID. I think all of us are learning how to wash hands, and that's the same thing with diarrhea also, So the most important thing is the person cooking the food should definitely wash their hands after using the restroom and before cooking food, before feeding a child. Definitely at least for 20 seconds, hand washing must be done. Children should be taught to do hand washing before they start eating. When they come back after playing, children should be taught to wash their hands. Nails should be kept trim so that no dirt accumulates below the nails, and then they eat with that. That can cause infection. So that is something that can be done. The other thing is clean drinking water. So water, nowadays we get canned water and all that, which is all purified and things like that. So things are much easier. But supposing someone does not have access to that, what they can do is boil water. Ordinary water can be filtered, can be boiled. The important thing is it should definitely be brought to a rolling boil and maintained at that for at least 1 minute. So 1 minute, it should only then the water will become clean. So that is an important thing. Then, of course, clean food. You try and avoid outside food. Vegetables and fruits should be cleaned very well before giving it. And children should ideally be given freshly prepared food. So these are some of the things that we can do as far as what is going in. The other thing is maintaining the environment, because children tend to crawl, especially when they start crawling, and when they just start walking, they have this tendency to put their hands all over the place or take everything below and put it into their mouths. So keeping that area clean helps to a great extent. And the other thing is their toys. It is always good, to have washable toys. instead of having these soft teddy bears and, because those are much more difficult to clean. So if you have things like soft washable, toys which can be washed with soap and water, that will help to a great extent. So these are things about keeping the environment clean and things like that. Breastfeeding plays a major role in prevention of diarrhea, because breast milk has got a lot of factors in it, which tends to give a lot of protection for the baby. So definitely breastfeeding should be done, exclusive breastfeeding for the first 6 months, where nothing else goes into the baby's mouth. So chances of infection from something else is almost nil there. Plus the protection from the breast milk the baby is getting. And breastfeeding should be continued up to the age of 2 years. So that definitely does help. The other thing is, of course, a balanced, nutritious diet, which always improves immunity. So vitamin A containing foods, it helps in improving immunity. For example, orange colored vegetables, like carrots and squash and green leafy vegetables, oranges. All of these are vitamin A rich foods, which definitely help in improving the immunity of the child. So the child should be given a balanced diet prior, before all of this, and definitely continue the nutrition during the diarrheal episode also. Don't withhold things during the diarrheal episode. So that is another thing that can be done for prevention of diarrhea. Then vaccines play a major role. As I said, the most common cause of diarrhea in children is still viral diarrheas, and the most common virus is rotavirus. So now we have this rotavirus vaccine, which is very easily available, not too expensive, which can be given. Only thing is, it should be given very early. So usually we give either 2 or 3 doses starting at 6 weeks. So it should be given at that time. And ideally, we need to finish our first dose before 16 weeks at least. So it should be given very early. So that prevents rotavirus infection to a great extent. Measles vaccine has been found to be very useful in preventing diarrheas. So measles vaccine also should be given. So these are some of the things that can be done to prevent the diarrhea.
So now with COVID, in the season of COVID and now dengue starting, so does children have to be given any extra precautions so that they, as you rightly said, that diarrhea is also one of the effect of COVID infection. So what are the special care that needs to be taken for children to protect them from the entire pandemic of COVID and the upcoming dengue season in place?
Yeah. Dengue, of course, we know is a mosquito-borne infection. And the important thing is dengue, the mosquito that brings out the dengue infection, breathes in good, clean water. So the important thing is, how do you store water at home? Flower pots and things like that. So you should make sure that collecting water at the base of it should not be done. So all those kind of things should be kept clean. If at all you're collecting water and keeping it in bins, it should be kept covered. So keeping the premises clean is one important step in preventing dengue. That's one thing that can be prevented. And usually, evenings, babies going out should be fully covered. If you're taking a child out in the evenings, to prevent a mosquito bite. So cover them completely so that they don't go out and get bitten. So that's the other thing that can be done to prevent a dengue infection. So that is one thing. COVID, of course, it is exposure to a COVID positive patient. So children should not be going out at all. Now with schools and all that all online, so it is quite convenient to keep children indoors and things like that. And teaching them hand washing. So hand washing is something that it goes a long way. And if there is a COVID positive patient in the house, keeping children away from them, wearing, children older than 2 years, we advise masks. So children being taught how to start wearing masks, they should be taught that starting at home. All of a sudden, when you take a child out and you tell them to wear a mask, they are going to be petrified because they don't know what this is. They probably feel that they are suffocating, they can't breathe and all that. So start doing it as a game in the house. Put a mask on their favorite toy, and say, see, your doll is wearing it, your toy is wearing it, so you also start wearing it. Or make a cartoon picture on the mask, So try to make it like a game, so that the child is not terrified about the mask and what it can do, So the child should start feeling comfortable in it at home, so that if at all the child has to go out, for example, to see a doctor for their vaccines or something like that, the child is used to wearing it. And, happy birthday, sing happy birthday twice, and that would be 20 seconds, so your hands get clean. So if you ask a child to do something like that, it doesn't become a burden. Children like to do things like that. So doing things like that is how you can prevent it.
So I'm sure our viewers who are watching this live would have definitely gained lots about what is diarrhea all about and how different it is from dysentery. And thank you, Dr. Deepa, and some take-home message from you.
The main take-home messages that I would like to say is, when a child has diarrhea, don't panic. So diarrhea is most often self-limiting. Use the wonder drug, ORS. Just because ORS does not reduce the purge rate, please don't take it and throw it out. ORS is not meant to reduce the purge rate, but it will definitely go a long way in preventing dehydration and even correcting dehydration. So continue giving ORS and look for warning signs. If at all you have any doubt that your child is becoming lethargic or irritable, or you feel that the child is getting dehydrated, I think you shouldn't hesitate to reach out to your pediatrician. Nowadays, you can consult online, you can call, or if you don't want to bring in a baby to the hospital, online consultations are available. Emergency rooms, usually with a 24-hour pediatric coverage, is available. So if you bring your baby in, without much delay, a pediatrician itself will be able to assess and see how you're doing with a baby. Never start antibiotics for a diarrhea unless and until it is prescribed by a pediatrician. Continue, breastfeeding should definitely be continued in small babies. Continue a normal diet in babies, and definitely don't miss out on the vaccines.
So thank you, Dr. Deepa. I'm sure this would have been an extremely informative session for our viewers today. Thank you so much for your time, and do get tuned in every Wednesday at 12 o'clock for more sessions to follow on Kids Health Talk from MGM Children's. Thank you and have a great day.